Atrial systole is one of the phases of cardiac cycle, and it happens right after ventricular filling. Recall that during ventricular filling, because of high pressure in atria versus low pressure in ventricle, AV valves open and a volume of blood flows from atria into the ventricles. And as soon as the atrial walls start contracting, we switch to atrial systole. Recall, systole means contraction in the wall of chamber, and since we say atrial systole, that simply means the wall of atria contract. The goal is that atria increase the pressure by contracting their walls and literally pushing more blood into the blood that we already have inside the ventricles. During atrial systole, since atria are pushing an extra volume of blood into the ventricles, it simply means that ventricles are receiving blood. And we know that when ventricles receive blood, the ventricular wall must stay relaxed. So in short, during atrial systole, the wall of atria contract, however, the wall of ventricle stay relaxed, and AV valves are open because blood has to flow, be pushed from atria into the ventricles. The entrance into the ventricles would be open, that would be AV valve. However, the exit out of the ventricle, semilunar valves, must be closed, simply because when ventricles are receiving blood, they cannot simultaneously push blood out. So in short, as a summary, atrial systole is a very short phase during cardiac cycle. In an average sized adult at rest, it just takes about 0.1 second. And it is called atrial systole simply because the atrial walls contract, as you can see in the image. And since ventricles are receiving blood, their walls must stay relaxed. Most of the blood that ventricles receive would be in the previous phase, which is ventricular filling, and during atrial systole, a very small volume of blood, usually around 25 milliliter, will be added to the blood that we already have inside the ventricles. And since ventricles are receiving blood, the doors open into the ventricles, AV valves are open. However, the exits from the ventricles, semilunar valves, are closed.